Wow. Hello. Good afternoon. I hate to stop the chatter. It's so thrilling to hear. Thank you for bearing with us. We're getting started a tiny bit late as we checked everyone in and got everything set up and ready. So welcome and good afternoon. I know most of you here, fortunately. I am privileged to have gotten to know a lot of you, but I also recognize that we have some special visitors today watching from home who may not know me. So for those of you, my name is Carrie Tom. I am an infectious disease physician. I'm a mom and a wife, and also the Associate Dean for Student Affairs, and I'm going to be one of your hosts today. And I am so happy to be here with everyone today for the class of 2023 Student Clinician Ceremony. Students, today we recognize your many years of hard work. We reflect together on what it means to be a medical professional. And we look to the future as we transition to the next stage of your journey in becoming a doctor. In just a few short minutes, you'll hear from Dean Reese, from selected peers, from Dr. Cross, today's selected keynote speaker, each of whom will share their wisdom, advice, and thoughts on what it means to be a medical professional. As we pause to celebrate milestones like today, I feel it is important for us to start with some purposeful gratitude. And I have a really long list, so bear with me. First, after over a year of personal interactions, formal and informal meetings with students, with colleagues, even with family and friends, done at a distance in front of a computer screen, and over a year of celebrating milestones like today, remotely via Zoom, I could not be more excited and more grateful to be here sharing the same space together. Indeed, this is our first class-wide in-person event since before the pandemic. And for that, I would like to express my immense gratitude to the international science and public health communities that have made vaccines possible and helped to curb this pandemic in our own community, allowing us to gather today. At the same time, I recognize our great privilege and acknowledge that vast work remains until the same can be said for all. To Dean Reese, thank you for your ongoing support and for being a part of today's ceremony. To all the faculty, many of my colleagues and friends who are with us today to witness this group of students take their own oaths of professionalism. Thank you for your commitment to education, for your passion for teaching and mentorship, and your dedication to your patients. You enrich my own work, and the students are so lucky to have you as mentors and educators. To the students, family, and friends who are watching on live stream, I think over here, thank you so much for sharing your loved ones with us, for encouraging and supporting them throughout the ups and downs of medical school. I also want to thank our Office of Medical Education, specifically Mr. Kevin Brown, Mr. John Seabode, and Mr. Cameron Gransom, who are helping to coordinate today's live stream events to make that viewing possible. Importantly, I also need to thank our SOM chapter of the Gold Humanism Honor Society for their partnership in hosting this event, many of whom are here with us today. Thank you to all the GHHS students who have taken the time to write a note to each of you in the class of 2023, welcoming you to clerkships. Thank you, students. I know this simple gesture is probably appreciated more than they could know. To our faculty advisors, Drs. Goyle and Dr. Levin, it is a true pleasure to work with such incredible physicians and educators. And thank you to our fabulous student leaders of GHHS, our co-presidents, Kayla Pulowski and Jennifer Drexler, who were not able to be here today, and our treasurer, Ian Chan, and Albert Zoe, who you will see in a few short moments. And finally, thank you to Ms. McCartan, who is probably behind the scenes somewhere. We are so grateful for your dedication to your work, to SOM, and to the students, as well as for your excellent organization skills and planning. I'll keep the remainder of my remarks brief, but for you, the students, today marks your transition into the advanced clinical phase of your training. You went from the anatomy lab, the libraries and the lecture halls, and more than we wanted to amount of time in the Zoom classrooms. With a quick detour through dedicated, and now here you are, moving on to bedside. Wasn't that quick, right? In a few short days, you'll be joining the healthcare teams, working amongst other healthcare professionals and contributing directly to the health and care of others. Over the last week and the preceding weeks, I've had the opportunity to talk to many of you, and I know on your mind, you're beginning to contemplate your own role on the healthcare team. Patients and families will look to you as their doctors. You will provide comfort, a listening ear, and a healing touch as you navigate the patient-physician relationship. Your presence and enthusiasm alone elevates the academic environment of the healthcare team, and together with like-minded peers, attendings, and interprofessionals, you will work toward the collaborative goal of providing safe and effective patient care, contributing to the health and wellness of the population. Your dedication, courage, and compassion will drive each of you to advocate for your patients now and to create needed change throughout your careers. You will experience all the joys of medicine, as well as the many challenges. And I'd like to take a moment right now to recognize those challenges, some of which might be shared and some of which are likely to be unique to your own personal journey. But today, while we're together, I wanted to make a point and make a commitment to each of you that if you ever find yourself at a loss, feeling that you have nobody to turn to or no place to turn, whether that is tomorrow, next month, next year, during your internship, or even many years into the future after your graduation, I want you to know that there will always be a place for you in the OSA hallway and at SOM, and that you are never alone. You have many advocates and many people who care about you, and it is important for me that you hear those words today. While we recognize these challenges, we also have to embrace the joy, and there is so much of it. So please take the time to find that joy in the everyday moments of medicine. They are all around you. All things have led you here, and you are more than ready for what lies ahead. Thank you. And I'm going to invite Ian Chen up to the podium, your GHHS treasurer. He is going to introduce our next speaker.
Thank you, Dr. Tom, for your inspirational and comforting words. We will now hear remarks from Dr. E. Albert Reese, Executive Vice President for Medical Affairs at the University of Maryland, Baltimore, John Z. and Akiko K. Bowers Distinguished Professor and Dean of University of Maryland School of Medicine.
Good afternoon. I'm delighted that you are all gathered together for this special occasion. This is a testament to how far we have come in this global fight that began more than a year ago. I apologize that I could not join you in this event personally today, but I'm delighted to be able to recognize and honor you at this important milestone in your careers. This ceremony signifies your preparation to enter the next season of your academic journeys. You've spent 2 challenging years in the classroom, one of which you spent in the virtual classroom, which one may argue was even more challenging. You began your medical education in a rather traditional manner, but after about a year, you were thrust into a new reality of COVID-19. You were required to pivot and transition to a new learning style that none of us anticipated would be necessary. Through the sudden change, the unknown, and the challenges that virtual education inevitably brings, you did not miss a beat. You are now equipped to confront the real-life challenges that your medical professions will undoubtedly bring. Nevertheless, this is a very special time to be entering the clinical setting, and I'm sure you are very eager to do so. Although we are still living in a pandemic, we can be thankful that for us here in the United States, it appears that we are emerging from the darkest points. We must never forget the pain and the suffering in other countries throughout the world. that are still in the throes of this pandemic. The University of Maryland School of Medicine has tried to do our part in various ways to be helpful locally, nationally, and indeed globally. You begin your third year of medical school and begin interacting with patients. You will serve as beacons of hope and a presence of comfort to those in greatest need. I challenge you to always remember the human beings behind the diagnoses. As the father of modern medicine states, William Osler himself, and I quote, "The good physician treats the disease. The great physician treats the patient who has the disease," unquote. When we prioritize the patient over the pain, we help our patients see beyond their current state. During today's ceremony, you will receive your professional pins for your white coats. As you begin the next phase of your medical education, you want to revisit the oath taken during the white coat ceremony and recommit yourselves to the promises that you made at that time. The pin will serve as a constant reminder of your commitment to your patients and to your profession. Please do not ever forget the tremendous responsibility that you have for your patients. The manner in which you practice medicine today will in part determine the nation's quality of healthcare tomorrow. In closing, let me leave you with the charge that in all that you do, remember to achieve honor, achieve integrity, and achieve selflessness in your own relentless pursuit of excellence every day. May God bless you in all that you do. Thank you.
Thank you, Dean Reese, for those remarks and, as always, for your support. Next, I have the honor of introducing Alexandra Martinson. She is a rising fourth-year student who is planning to apply into pediatrics for residency this year. As a second-year student, Alexandra served as the Student Council President, organizing large-scale events to foster community amongst medical students of all years. She has also engaged in pediatric otolaryngology research at Maryland, in addition to advancing her college research about neurosmartphone apps, leading her to present her work at conferences. Today, Alexandra comes to share a few words of advice and thoughts on life from her experience as a third year entering the clinical world. Alexandra?
Thank you, Ian, for the kind words. I am very excited to be here with you all and to be able to tell you congrats. You've put in so much hard work through 2 very different preclinical years, and this ceremony marks the transition to work on the hospital floors. With that, please humor me with a quick mental exercise. Everyone, close your eyes. Bring back your personal statement for med school applications. What was your spark to medicine? What motivated you to work so hard and dream about entering this profession? You can open your eyes. That exercise was to say that you finally made it to that point that you almost likely wrote about in those statements. Getting to the hospital floors and being able to take care of patients. I feel very lucky to be able to share a few of my takeaways from the unique and privileged whirlwind that is third year. I just finished on my internal med rotation, and one encounter in particular embodied the third year learning process for me. I saw the chief complaint of abdominal and back pain. I went down to the ED and found my patient with the blanket over her head. She almost immediately said, "Can we not?" She was withdrawing, needed her methadone, so I came back later after she received her medication. She answered about 5 questions and then started repeating, "Are we done yet?" I didn't push it. A few hours later, I came back down to the ED. Third time was the charm. After sitting together and talking about her current social situation, she felt comfortable sharing her medical history with me. Long story short, She had kidney injury related to chronic substance use and needed help getting into couples rehab. I didn't even realize couples rehab was a thing, but setting that up, in addition to a renal biopsy, became the two major goals of her care. I got to spend a week with her, checking in on medical updates and listening to many of her social determinants of health. Turns out she had renal amyloidosis. Yes, all the flashcards and questions just came to life. But appreciating how her social situation was related to the pathophys became the most critical part of her care. We were able to set her up in rehab, and she was so grateful on discharge, telling us how much she appreciated the time we took to listen. She ended up leaving rehab after a few days, though. Apparently, the location was close to where she previously used drugs, and it was triggering. I initially felt guilty, like I should have known to ask where she was using. But I didn't know to ask that specific question. It was one of many mistakes I made through third year, and those mistakes were how I ended up learning and being able to better help the next patient. Reframing my response to getting things wrong or not knowing what to do ended up being one of my biggest areas of growth this past year. Embracing getting things wrong ended up turning into opportunities to do right for someone else. This past year taught us resiliency and creativity. We had to get comfortable with studying from home and maintaining social networks, motivation, and hobbies, or whether it was in the hospital, navigating care for patients where the full disease process was still being studied. We all had to get comfortable addressing questions we were not explicitly taught to answer. Learning medicine in the wake of a pandemic is going to be both difficult and so helpful to your future careers. You will see that medicine is not practiced in a bubble. It's deeply intertwined with current events, inequities, resource allocation, and creativity in answering those unknown questions. There will always be more learning to do and new perspectives to take in. Don't be afraid to fully immerse yourself in all the novelty that lies ahead. By diving in wholeheartedly, you're one step closer to addressing that little elephant in the room of what type of doctor you're going to be. Third year was the most unique experience of getting to live the life of 8 different specialties. Any point during the year is a chance to learn about yourself and find a field that fuels you. This is coming from someone who made a big switch in February. Whatever you choose and whenever you choose it, just do it. This is not sponsored by Nike, although that would be nice. Still working on the corny jokes for pediatrics, but anyways, get ready for the whirlwind and all of the excitement ahead, and realize how much you've grown over the last 2 years. Also, take quick snapshots of all the moments throughout this year because time really does fly and opportunities are around every single corner. Congrats MS3s and have a wonderful first year of clinicals.
Thank you, Alex. That was wonderful words. Next, it is my great honor to welcome our keynote speaker, Dr. Donique Cross. Dr. Cross is a clinical instructor here at the University of Maryland in the Department of Family and Community Medicine. She was born and raised in Jamaica and immigrated to the United States to attend college at Howard University, graduating summa cum laude with degrees in biology and Spanish. She attended medical school here at the University of Maryland, where she dedicated herself to primary care and serving the underserved populations through involvement in the primary care track, the Student National Medical Association, and projects with the Baltimore City Health Department and the Women's Health Clinic. She was recognized for her humanistic approach to medicine as an inductee into the Gold Humanism Honor Society, and with the doctors Harry and George Knipp Award for Excellence in Humanistic Care from the Family Medicine Department. She pursued residency in family medicine at the University of Pennsylvania before returning as faculty here at Maryland in 2020. She also serves as the practice of medicine preceptor, educating the next generation of aspiring physicians. She was chosen to speak today by students from the Gold Humanism Honor Society because of her dedication to primary care and underserved communities, as well as diversity and inclusion in medical education. In just 1 year as a faculty member, she has stood out to students as a role model and leader in compassionate medicine. When we asked our students who they thought would be a good representation of humanism as a clinician, our students responded overwhelmingly with her name.
One student stated, quote, "I had the privilege of watching Dr. Cross interact with her patients, something that she did with incredible empathy and compassion. As a family medicine doctor, she is required to bring an artful level of humanism to her practice." Another student said, quote, "She is an excellent clinician and treats her patients with great dignity and respect. Dr. Cross created an incredibly welcoming learning environment, and I'm grateful for her advice and words of encouragement. I hope to emulate Dr. Cross's compassion and clinical acumen in the future." Dr. Cross is someone who truly captures what it means to provide patient-centered, compassionate care and teaching others to do the same along the way. Without further ado, I would like to thank Dr. Cross for being here to speak to us today. And now I'd like to turn the floor over to her. Dr. Cross.
Thank you, Albert, for that wonderful introduction. Good afternoon, faculty, students, and guests from home. Thank you to the Gold Humanism Honor Society and the class of 2023 for inviting me to be here with you all today as you celebrate another of many milestones to come in your medical careers. This truly feels like a full circle moment, since it was not that long ago that I was sitting here in your place at the University of Maryland. After 2 years of laying the groundwork, you are finally ready to hit the wards and make a difference in the lives of your patients and their families. This is an exciting day, and I hope you take the time to celebrate this occasion and your accomplishments so far. You all have demonstrated that you have the resilience and the adaptability to succeed in medicine. In the midst of a global pandemic, you retrained your minds and your routines to learn and study in a way that I'm sure felt unnatural to many of you. I certainly never imagined that I would teach you physical exam skills or review standardized patient encounters via Zoom. Yet, here you are. You've made it to the end of your preclinical years and are, without a doubt, ready for the next step. I can't say that what comes next will not be challenging. The upcoming year will take you through highs and lows that will shape you into the clinicians you will become. Through the early mornings, late nights, and missed family events, you will acquire the clinical knowledge you need to succeed in your chosen specialty. There are a few thoughts that I always reflect on during my most challenging days, and I'd like to share them with you today. First, and Alex was on the same page with me here, remember your why. When you applied to medical school, you documented your why in the form of your personal statement. Of course, as you gather new experiences, your whys might change. But always hold on to the why that led you to medicine in the first place. If you can, reach back for that medical school application and read through your personal statement. Look back at what motivated you to start this journey in the first place. And as you go through rotations, think about those times that give you that aha moment, those times that make you say, yes, this is why I'm here. And if you're lucky, you'll feel this way on several rotations and end up becoming a family doctor like myself. My second piece of advice is aim to thrive. A few times in residency, and even as a medical student, I caught myself responding to the question, how are you? With a, oh, I'm surviving. Many of the upcoming days will feel like you're in survival mode, and that's okay. But remember that mode is temporary. Once in a while, it's important to look up from the day-to-day of what you're doing and try to reroute yourself to thriving mode. Sometimes that means working out or catching up with family or old friends instead of doing those 20 UWorld questions you plan to do. Or sometimes it's just pausing for a moment of gratitude for the everyday miracles we are privileged to witness in medicine. You would be surprised how going back to the basics of what makes you you can fill your cup and prepare you for the next challenge coming your way. Third, go through every rotation with an open mind. Hold on to the firsts and the potential lasts. I knew very early on that the OR was not for me, but I still remember enthusiastically scrubbing in on my first Whipple, doing chest compressions for the first time in shock trauma, and going to St. Joseph's Hospital to procure a pancreas with the transplant team. By the time you get to your obstetrics rotation, you may have already set your sights on ophthalmology, but it may be your last time you get to deliver a placenta or even a baby. Perhaps you'll discover a specialty like family medicine that you didn't consider but totally fits. Truly immersing yourself in every experience will enrich your education even more. The next few that came to mind are centered around patient care. Treat patients like people first. Ms. Jones is a patient with diabetes, not a diabetic. Mr. Jones is a patient with sickle cell anemia, not a sickler. And at this point in your training coming up, you'll have the privilege of having time to spend with your patients. Make a point of being a good listener. It can go a long way with your patient's experience. That being said, remember that although you're there to learn, you're a part of the medical team and you belong there. It was not that long ago that I was a medical student jumping out of the way to make a workstation available for the senior resident to use, or trying so hard to remain engaged and avoid being forgotten that I followed my attending into the restroom. Even when those things happen, and they will, remember that you belong and you're appreciated. My last bit of advice is to be the change you want to see. In the past 13 months or so, we've seen an unprecedented shift in the value placed on social justice and equity in medical education, in healthcare, and in the society at large. You all have had the privilege to learn the foundations of medicine at a time when attention to patient-centered, anti-racist, and gender-inclusive language has become a top priority. However, as you move through the wards, you will likely find that there is still so much to be done, so much further to go. On the wards, if you see something that's not right or is unjust, I challenge you to speak up. There have been many systems level changes born out of the efforts of medical students and residents. As a student, you might feel like you have no power to effect change, but the moment you walk through these doors, you inherit the power of a system, for better or worse. It's up to you to harness that power for good. As a medical student, your voice has more power than you can imagine in a system where many feel vulnerable and voiceless. I challenge each and every one of you here today to tap into that power and be an agent for change. We can and need to work together to make healthcare a safer, more equitable service that is a right for all. In closing, I hope that you find joy in the journey ahead. Take in all the lessons and know that you will end the year one step closer to your why. I wish you all the best of luck, and I can't wait to see what you accomplish. Thank you for having me.
Thank you, Dr. Cross. Congratulations, everybody. I love that advice. Be the change and remember your why. I'm going to take those with me today as I head back to surgery this afternoon after this wonderful ceremony. So together, we're going to recite our oath, which you have in your program. Okay. As I begin this next stage of my medical education, I pledge to act in the best interests of my patients and to serve them with integrity, compassion, dignity, and respect for their beliefs and circumstances. In doing so, I will remember that warmth, empathy, and the art of medicine are vital, the scientific knowledge to the care I provide as a healer, educator, and advocate. To these goals, I dedicate myself in the honorable traditions of the School of Medicine. So I'd now like you to take your pins and you can pin the student next to you. So pin each other. If there's nobody next to you, you can find a friend. Okay. Congratulations. I would now like to invite Dr. Carrie Tom for the concluding remarks.
Okay. Thank you, Dr. Levin, for leading us through the oath. Thank you, Dr. Levin, for leading us through the oath. I truly feel fulfilled today, uplifted, and so inspired. Thanks for everyone for being a part of this ceremony. To our speakers, Alex and Dr. Cross, you are both so poised and had such wise words for us today. They were so inspiring. Thank you so much for being here. And students, we cannot wait to see you on the wards. Your teams and your patients are waiting for you. Congratulations, class of 2023. We are so pleased. We are closing the ceremony and we are going to take a group picture today. So we're excited to do that. We are going to have the picture downstairs as you head down the stairs behind the coffee shop and the information desk on the first floor there. All right. Let's navigate our way that way.